Hello, this is Dr. Don Reagan, and this is a mentorship moment. We are here speaking with Zach and Candace of McMinnville Physical Therapy Practice. Zach, tell us a little bit about your success manager.
Well, our success manager is Candace Rowland. She started with us, is it 10 years now?
9 years.
9, and we're building on 10 years. It's been incredible to have someone with us for that long that has grown with us. And she has certainly grown in her expertise and her skills. She started as just taking intakes, and now she's grown into the role of the success manager. We're a private practice clinic here in McMinnville, Tennessee, in a rural area of Middle Tennessee, and we see a variety of patients. And she is the one that starts the conversation, and she's also the one that ends the conversation when they go to sign our Wall of Champions and they graduate. So she is integral with that. We call her a success manager because if there is an issue anywhere within the clinic, she wants to make sure that it's prevented or that it's addressed. And so she's got a very broad role to help us with. So that's our success manager, Candace Rowland.
Hello.
Candace, tell us what do you think is the most important thing you do for the patient experience?
When I call the patients, a friendly voice, making sure they have the correct date and time, making sure they arrive 30 minutes early to fill out their intake. That way the therapist can start right on time. Here we try to start exactly right on the dot at their appointment time. There might be some cases where it's 5 minutes late, but for the most part, we start exactly on time. When they get here, I will I'll ask for their insurance cards, and then I'll hand them their paperwork if I haven't already filled it out online. And just have a friendly conversation while they're there. As soon as they get their paperwork in, I will hand it to Zach, and he'll go through everything and then get the patient going on their session.
So it sounds a lot like communication is really critical in patient success.
Yes.
What are some of the insights that you might give your therapists about an incoming patient, a new patient? Is there things that you pick up on and you try to share with the therapist that may not be on paper?
Yes, I try to pick up on that during my phone conversation. That way they are aware before they arrive. Sometimes I do find out when they do arrive. If they are just seeking home exercise program, I'll let Zach know, and I'll also type it on the appointment. That way it's a double whammy there. Also, if their co-insurance is 100%, they have to pay 100% each visit, and they just can't afford that. I always try to get them in to the first appointment and let Zach know that, they really can't afford to come 2 to 3 times a week. So really work on the home exercise program.
Great. What are some of the primary things that patients complain about that I assume you hear?
I don't hear a lot of complaints. It's more of, man, they worked me hard today.
Okay. Great.
I really don't hear a lot of complaints.
Well, it sounds then like you're communicating well with the patients, because in my private practice experience, it was money. Patients would complain about what do they owe, how much money are they going to be required to pay, and then miscommunications like when's my appointment time, or came late, came early, can I be seen at a certain time, can I be worked in? But you're not experiencing a lot of that in your practice.
No, because when I'm on the phone, I check their insurance benefits beforehand before I call the patient. So they are aware before they walk into the store of what they might owe. So that's not an issue here. I guess, if they need a certain day, a certain time, I try to work my best on getting that for them. It might be a few hours off, but in the long run, the first 2 weeks, I tell them it might not be exactly what they want, but after the third week, we can certainly get exactly what they need.
And Don, Candace has us as out on the clinical staff very well trained. So she runs our team meetings, and I think we hear it probably about every month. Our next team meeting is actually tomorrow. We'll probably hear it. Continue to remind your patients of their next visit. So the last thing out of my mouth besides have a great day is I will, see you on Thursday at 3:00. She has us ingrained to do that. So it's not just about what she's doing, but she's getting that double effect, making sure that we're trained. And sometimes things do come up. Oh, I can't do it then. I've got a doctor's appointment. Oh, let me get you a progress note to the doctor, or let's reschedule it. But she does a really good job of accommodating the patients with scheduling challenges, but also keeping us on the ball to make sure we can help her at the same time, which helps us.
And that's really, I've seen a really big difference on no-shows when they remind their patients of when their next appointment is, by a significant amount since we started doing that. So I would suggest any practice for the PT, PTA to remind their patients of their appointments for the next visit.
It sounds very collaborative, like you're working as a team, not just a clinical side, but the administrative side as well.
Right.
So what are some of the important things when you onboard a new clinician into your practice that you are emphasizing for them to be successful in your practice from an administrative perspective?
Well, I haven't done that yet, but I think I would. We're about to have one. I would drill into them to remind their patients of their next appointment. Also, starting on time. If there's ever an issue with a treatment, to come to me. That way we can figure out what's going on, what's going wrong, what's going right, and kind of diffuse the situation a little bit. As well as I would probably tell the owners about the issue. But hopefully we won't have any issues. So that would be awesome if we didn't. But there are those certain patients that are just hard to handle sometimes.
Yeah, I guess I'm curious with some of my questions about conflict resolution. I'd asked you a little bit before about when patients complain, and I mean that has to happen at some point. And so with if a patient has a complaint, how is that processed in your clinic, or how is that monitored?
I will speak to the patient one-on-one. I will take them into the room, my office, and just kind of feel what's going on. And I'll try to diffuse the situation as much as I can. I'll also call the PT or PTA, whoever it was with, into the room and have a conversation with them. And then reassure the patient the next visit that the situation shouldn't occur again.
Mm-hmm. Yeah, that's great. Do you think it's important that your patients are communicating with their clinician, but also with the non-clinician in the practice? Is that an important piece? Do you feel like your patients maybe speak to you differently than they do to the clinicians?
I think up front on my side, it's not more physical therapy. It's more of just an everyday conversation, how they're doing. Did you go fishing the other day? Just kind of remember the conversations we've had before and just kind of picking up with that. Physical therapy wise, I'm kind of in the back as well. Some days helping out with exercises. And it is a different conversation because you're more worried about their pain versus what they did yesterday.
Mm-hmm.
So having a conversation with them, pain wise versus everyday life, is a different atmosphere. But of course, if they're having pain, I'll go to the PT, PTA, and then they will come over there and address the situation.
Awesome. I'd like to switch gears with my last question, Candace. I personally have never worked for the same employer for 9 years. And so I would love to know why have you been at the same clinic for 9 years? That seems extraordinary, especially over the last couple of years of the pandemic, et cetera. So what's that like? Why have you been there for 9 years?
Well, they're like family now. I mean, you have to have a team and you have to have a great environment. I have worked for employees where they were not so great. And just here, it just feels like home. So that's what's kept me here for as long as I have been. Um, you know, every day I'm like, I like working here. So if I didn't like working here, of course, I probably would be hunting for another job. But um, like I said, the workers are what makes it here. So
I mean, she is definitely part of the successes of our patients. And, from my standpoint, that's always been really important. When I'm graduating somebody and I'm walking out with them, and an assistant's had a lot of time with them, I don't just walk them to the front. I make sure that assistant's, hey, Julie, Miss Smith's graduating today, and then they get to have their moment together. But all these things I always try to remind and bring these just appreciate Candace and getting things set up for us. We had a lady that ended up having to go to the ER with potential TIA, and she followed up with that lady the next day, and just appreciated her reaching out to that lady. And those kind of things, just showing appreciation for Candace is really important across the board, because really we wouldn't be having successes in the clinic if we didn't have Candace doing her magic in all of their aspects.
I feel
Wonderful. Thank you.
valued.
That's awesome. Thank you so much for giving us a snapshot of your practice and for
Yeah,
sharing a little bit about your day-to-day.
you're welcome.